Good afternoon, Kevin. My name is Jaya, the pharmacy technician here. How are you doing today?
Good afternoon. I'm doing good. How about you?
I'm good too. I just saw that your doctor prescribed some meter dose inhaler, the Ventolin, the generic version of Ventolin for you. So, have you used this inhaler before?
No, actually, it's my first time.
Okay, no problem. Are you using this inhaler to control your asthma?
Yes, definitely.
Yeah, just would you mind just giving me 5 minutes to show you how to use this inhaler?
Sure, no problem. Take your time.
Okay, sure. And before we start, just to let you know that there's an instruction sheet in the box. If you miss some steps or got confused at home, you can always take out this instruction and read by yourself, okay?
Yes.
And yeah, this is a meter dose inhaler. This is a generic version. Salbutamol is pretty much just Ventolin, but it's a generic. So for this inhaler, you always, before you start to use it, always shake well, shake vigorously for at least 10 seconds
Yeah.
so that the medication can be fully mixed with the propellant. Okay,
Okay.
that's very important. And if it's your first time using it, or it has been sitting there for 2 weeks without using it, or you just drop it on the floor, you need to prime the inhaler. uh, Priming the inhaler is just to making sure the inhalers are working properly,
Yeah.
and also making sure you are getting a full dose when you give yourself a puff. Okay,
Okay.
so in order to prime it, you just shake well, shake really, really well, and then remove the blue cap on this end,
Yeah.
and then take away from your face
Okay.
and give a puff. And then wait a little while and give another one. Just give 4 puffs. That's how you can fully prime this inhaler. Okay. So after you prime it, after shaking well, you can start to give yourself a puff. It just before you do that, you just breathe out slowly, fully breathe out, and then start to breathe. Before you breathe in, you put your put the mouthpiece. This is the mouthpiece inside your mouth.
Okay.
Make sure your lips are closed around it.
Yeah.
Make sure it's sealed so you can get a full dose.
Okay.
And then start to breathe in slowly. While you start, just after you start to breathe in, you give a puff. Press here and give a puff. It takes some lung and arm coordination, but just give a puff after you start to breathe in.
Okay.
And after you fully breathe in, try to hold your breath for at least like 10 seconds. That's ideal, but sometimes you cannot hold it for 10 seconds. That's totally fine. Just hold it for as long as you can.
Okay.
Okay. So after you give one puff, you still feel like your difficulty in breathing persists, you can give another puff, but wait 30 to 60 seconds, you can give yourself another puff.
Okay.
Okay, so yeah, and make sure on the box it shows that you never give yourself more than 8 inhalations each day. So if you still cannot breathe normally, then go to seek medical help right away instead of giving yourself like more and more doses. Okay,
Okay.
that's very important. And yeah, any other question regarding how to use this inhaler?
Yes, I do have like at least two questions. The first one is about the disposal. Like, as you know, if it's expired or like I'm no longer using it, so how do I keep it like the bottle? Or like, can I throw it like anywhere or like this?
No, I actually for this inhaler, if there's still medication inside, always return it to the pharmacy instead of throwing it in the garbage, because we don't want the medication to be in the environment, first of all.
Okay.
Second is that this thing has some pressure in that you don't want it to explode in the garbage, right? So
Okay.
always return it. Even if there's no medication inside, you just still ideally you just return it to the pharmacy to recycle it. Yeah,
Okay.
this thing is pretty difficult to recycle. So, any other questions?
Yes, and I just wanted to have like a kind of idea. Do you know like how many, let's say like dose or like how many times can I use it? Like to know like how many it's left inside or like something like that.
Okay, so this inhaler, the brand new one, contains 200 doses. It's written on the box. So, unfortunately, this is not like some other inhalers like Zenhale. They have a window showing how many doses. They have a like dose counter.
Yeah.
This one, unfortunately, doesn't have a dose counter. So you need to document by yourself how many doses you have given yourself. And also in this case, it just if you can shake it to feel how much is left, and if you feel there's really just nothing left, and just always make sure you get a new one. And documenting how many doses you have given also can help you estimate how long this inhaler can last you.
Okay. Thank you so much.
Yeah. Would you mind just quickly show me how you can use it?
Yeah, sure. So like you said, first of all, I have to shake it well to make sure like I have a full dosage, and then open it, put it like away from my head or like my eyes or something, and then give a puff first. And then after that, I can put it in my mouth, and then take like, let's say I can
you need to breathe in first.
Breathe in and then give a puff. And then I have to hold my respiration for like 10 seconds or like as long as I can. And then that's it, right?
Yeah, as long as you can, it's fine. So pretty much that's it. And that's how you can use this inhaler. Would you mind us just giving you a call maybe that after a week just to follow up and see how you're doing with the inhaler?
Yes, anytime you can give me a call after a week so that you can follow up.
Sure, and just in case you still have any question at home, just don't hesitate to call us, and we are always willing to help you out, okay?
Definitely, I will.
Yeah, no problem. And that's pretty much it. And thank you for your time, and thank you for choosing Humber Pharmacy, and have a great day.
Thank you so much. You too.
Thank you. Bye.
Bye-bye.